Hello, I'm Luke O'Neill and here I am in my lab in the Trinity Biomedical Sciences Institute. So this week on my COVID-19 update, long COVID, it's a very important part of this disease and of course lots of people are studying it. We're learning more and more about it every day really. And it's around 10% now they reckon will have these symptoms which persist. And it's brain fog, fatigue, muscle aches, all kinds of nasty symptoms can go on for months after you've been infected. And one big study shows if you've been in hospital with COVID and you're discharged, 75% will have long COVID symptoms. That's the more severe end obviously. So again, we're learning a lot more about long COVID. It reminds us how serious COVID-19 is. And scientists are examining lots of data from stuff happened, it seems like years ago now, but we all remember this Diamond Princess cruise ship where there was massive infection in February of last year. And an amazing number, 712 people got infected on that cruise ship out of about 2,500. 14 people died of COVID-19. At one time, back in February last year, half of all the world's cases outside China were on that cruise ship. Now what happened there? Well, it turns out they knew at the time that this virus was spreading mainly through aerosols is the first thing, not through surfaces. And doctors were kind of ignored, and the ship's doctor had said this. He also said it was asymptomatic spread. So you might have no symptoms and you spread to someone else. He was observing all these patients. And the big report came out and people kind of ignored it and said, well, no, surfaces are very important. So that was one thing that we look back on. That cruise ship definitely was evidence for spread through aerosols. And a second big study was done with the Skagit Valley Choir. It's now infamous, where 53 people in that choir were infected in a single night. And again, the question was, how come that happened? At the time, surfaces were blamed again, hand washing not being good. But now the evidence clearly said that it is aerosols again, people singing and spreading through the air. And what of course this means, and we know this now, don't we? Good ventilation is key, and wearing masks, because that will stop the spread through an aerosol. And those two studies really sort of suggested that. One question is why the CDC and the WHO didn't pick up on this more quickly. They kind of ignored the data. And some of the scientists have said they were gaslighted, which is a very interesting term. What that means was they began to doubt their own data and began to think maybe I'm a bit crazy here, and began to change their minds a bit. So gaslighting was happening against these scientists in many ways, and that's a very interesting development. But certainly the science is so strong now behind those two studies. Surfaces are not really a risk, which means we shouldn't need to be washing surfaces all the time, is the key message from this. And all the talk again is of the blood and with clotting with these vaccines, as we know, and also the risk of clotting from the virus is huge anyway. And one study a few months ago now said if you're a blood group A, you're at higher risk of severe disease, and that was interesting. No idea why that would be, by the way, at the time. But now, lots of data, lots of examination of this, and it turns out there's no link with blood group A at all. Those early studies got it wrong. So if you're blood group A, there's no need to worry that you're at higher risk of infection. And you can hear about these stories and more on my weekly COVID-19 update with Pat Kenny on Newstalk.